The least painful one for the patient will be the submammary folds. The most painful will be through the armpit. Yes, and the least complication, bleeding or asymmetry or capsular contracture. I found it to my experience and with other my colleagues that the submammary folds approach would be the least problem because we can see it clearly. We can stop the bleeding very clearly and we can hide the scar. Especially for Caucasian, the scar will be negligible if you place it in the right place. Through the armpit is a good choice as well, but through the armpit you need a scope. Otherwise, you don't see the bleeding points, and you are not 100% sure that whether you have created the ample good pocket. And some patients say that they misunderstood that, oh, if you go through the armpit, you can have a smaller incision. The answer is no. This is a wrong understanding because the size of the incision is governed by the size of the implant. So if you put a bigger implant, no matter you need the same cut wherever you go. If you go through the armpit, you might need a little bit bigger because it's a distance to go through the breast, and it's harder to squeeze in, and then you have more chance that it can break. So I have done a lot that 10 years back, but the last 10 years I do it mostly through the submammary folds.